At one time, polio paralyzed hundreds of thousands of children every year.
Tragic aftermath.
In Africa alone, it afflicted 75,000 children annually. That's no longer the case.
We have just achieved a major milestone in global polio eradication with the certification of the African region as wild poliovirus free.
Was the first child to receive an injection of salt polio vaccine.
A vaccine ended polio in the developed world more than 50 years ago. In 1988, the Global Polio Eradication Initiative decided to end polio in developing countries. It's taken a lot of work, countless volunteers, global leadership, local leadership, and the backing of many donors. But now, the wild polio virus exists only in Afghanistan and Pakistan. In both countries, there has been a resurgence of the virus in recent years. In Pakistan, people displaced by violence and conflict have resettled in communities with poor health services and sanitation.
Polio virus is very unforgiving in these communities. They're densely settled, they're, poor sanitation and hygiene. The conditions are very favorable for poliovirus transmission to thrive, to be really entrenched there.
Jafari says the eradication program is now helping these communities meet more of their health needs, like access to clean water. In Afghanistan, the Taliban doesn't allow mass inoculations or house-to-house immunizations.
If you don't do house-to-house campaigns, can you perhaps carry out immunization campaigns in small immunization centers, many small immunization centers in a particular community, so that families don't have to travel very far to have their children immunized. So we're trying to be creative and looking at ways to move our polio eradication efforts forward in those two remaining endemic countries.
Because of the coronavirus pandemic, vaccinators in all countries wear masks and gloves. Global polio eradication is close, and the milestones are significant, but unless the disease is wiped out in Afghanistan and Pakistan, it could once again circulate globally. Carol Pearson, VOA News, Washington.